Okay, so going through the arm, the soft tissues, it is relatively rare that you have any reason to really interact with the deltoid. It's not impossible, but if you check all the three borders, as I tend to term them, of the shoulder girdle, so pec, lateral border, medial border of the actual scapula, and the shoulder isn't quite coming around, you can check the deltoid. So to check the deltoid, you need a relatively still humerus and a still scapula. So if somebody's in seated, generally don't work on the arm in seated, it's just hard work. Generally, but it can be done. So contact is control and control is safety. The space between us, table makes stable, less stable means I need to make this patient stable. The space between us is unstable, right? So I get nice and close, right? This forearm contacting the scapula, wrap around. I now have he's pinned against me and he's kind of trapped. So if I wanted to check the deltoid here, there you go. Now, you're going to see, if I pull too hard, right, I'm not checking the deltoid. So I kind of got to lean into him and trap him, and I got to use my eyes. So I want to look and make sure that I don't get the auxiliary movement there, right? So if I pull too hard, right, so if I'm just looking here, I won't necessarily notice his hands. But if I have a more broad focus, now I have to close my eye. If I do this, it's going to get weird, but you see that moving? So relatively speaking, I'm getting some information, but there is some auxiliary stuff. If I'm in seated and I want to check the tricep, I can check it from here. It starts to get awkward, right? So generally, I'm not going to do it. Like I'm not going to go through the bicep and tricep and seated. It can be done. You just have to control the arm. Usually you're actually better off in front of the person. You pin the arm against your side. Whatever. Yeah, face that way. Yeah. So people will be able to see it if we're over here. So, right, pin it, bicep, tricep. Okay? Right now, if I'm doing this, it's not that you don't get it. You can watch it and make sure it doesn't move, but contact is control, control is safety. There you go. There you go. I can check it, right? So something there-ish, right? No problem. Okay, so we're going to have you lay on your side with your head up here. Sorry for all the movement. Thank you. Because this just makes it easier for everybody in the room to see. So same concept. I need to control him, so I'm going to have some contact. I'm going to be in here, okay? Right, so now you see his scapula is pinned, right? I'm going to pin his shoulder, and I can go through here. Or I can go here and check it. Now I don't have all the auxiliary movement. It's better controlled. He's better pinned, right? So perpendicular to fiber direction. Yield to pressure isn't going to do a ton on the scapula, right? Would you agree that when I'm doing that, it's kind of hard for you to think that I know what I'm finding? Whereas here, right? It's not here, it's up here. Yep. Right, so broad contact for multi-point discrimination. As I move the whole thing, it yields down here. It doesn't yield up here. I'm getting closer to attachment points. I'm getting closer to tendency. You expect it to run out of some steam, but sometimes you'll find it in other places. Bicep from here, right? Push, pull, perpendicular to soft tissue fiber direction. Tricep. Now, if I'm back here, I can do it, it's not too bad, but it's probably better for me to put my hip on him, pin the humerus, so the humerus doesn't go anywhere, push and pull across, that's all fine. And again, as we found in seated, this is the same arm we had in, no, it's the other arm, wrong arm, opposite arm. Better than the other one, correct? Mm-hmm. It's getting tighter down here, but we're getting closer to the triceps tendon. So just that. Your hand is going to have to do different things depending on the circumstance. Now, it makes enough sense that would be exactly the same in supine. Like it wouldn't really be any different. In supine, when you're checking the tricep, generally drape the arm over their abdomen, so it allows you to get the humerus up and away from the side, because if it's at the side, then you have to lift it. But you just lay on your back. So just, God damn it. Stop talking, Sam. Or keep talking, but do. Lift your head. Thank you. Okay, you won't be able to necessarily see this, but so the bicep, not really a problem, right? I can kind of put the arm anywhere and the bicep, so you can see this, right? No problem. It's the same thing. Perpendicular to fiber direction, relatively shortened position. If I do this, it's harder to check, right? It doesn't work as well. It's not impossible, but it doesn't work as well. But for the tricep, right? If it's down here, I'm squished on the table, but if I bring it up here, I can check it now. It's not perfect, but it's okay, right? If I have to switch hands, contact, lots and lots of contact. Because if I just do this and run away, whereas I don't even have to I don't have to lean on him heavily. I literally just put my hand there and my whole forearm, and then I can get into that tricep if I need to. If I need to straighten it out a little bit more, so I get a little bit more play with it, or play in the muscle, there you go. Now sometimes it's going to be a little bit more thummy, a little bit more pokey, and other times you can get a nice thumb bar on it, so it's a little bit more like this. Sometimes it's more like this, sometimes it's more like this. So saying that and showing it with my hands, like the good old kitty paws, yeah. It looks funny when I do that, but it's to try to give you some stimulus pairing. But yeah, when you're checking the tricep, it benefits you to check it with the hand or the forearm across the abdomen. It just gives you the exposure to get to it. Whereas if it's directly on the person's side like this, even if they're seated, it's sort of stuck to them. It's harder to get to. You just do that, you get it better. The biceps not as hard to check, right?